Wonderful, everybody. Welcome to our February conversations on brain health. I will give it just a split second as I do see that we're going to have some additional folks joining us still. But for this evening, we have our lovely staff there at the MS Center at Rush. So we have our clinic nurses as well as our infusion nurses joining us for a topic that I think is great for everybody to be included on communication in our healthcare system, as well as tips and um, just overall important aspects of what to bring for your infusion visit. So I would like to just briefly say a big thank you to this team for joining us this evening. It really is an honor to have all of you here to show your faces so our audience all gets to know you a little bit better, because I think your work is really important at what happens there in the MS Center. So this evening we have Laura Coffey, we have Kamara Price, Danielle Salim, Sarah Straight, Madison Yeats, and Melissa Pokris, as well as Ifra Schill. Unfortunately, Lorena, who is also a key player at the MS Center, Lorena Racy, will not be joining us this evening, but Adrienne Castillo will definitely fill in and cover for her as well. So to kick us off before we go into our presentation mode, I would love for each of the members of the MS Center staff to quickly introduce yourself and maybe just say a real quick fun fact so everybody gets to know you a little bit better.
Hi, everyone. So thank you very much, Kathy, for your kind words. We're so honored to be here tonight with everyone and appreciate your time and attention. Rush nurses it's really a special population here at Rush. The Rush nursing staff is so competent and so ready to take care of you in the safest, best way possible, always practicing evidence-based nursing along with best practices. Having said that, I want everyone to know that Rush Nursing is going after their 6th Magnet Recognition Award this year. And that's really unprecedented for any nursing throughout the country. And what the Magnet Recognition Program acknowledges is nursing excellence, quality patient care, and innovation in professional nursing practice. So this is really, we put in a huge application to the Magnet organization. We prepare for months. Surveyors come, we have to present on our research, our innovative programs, and last but not least, our care. And then it's determined whether we are worthy of the 6th Magnet Recognition Award. So wish us luck and know that we're working on that every day. And it's just not the Rush MS Center, it's all of Rush. So when you come for your visit, you may see a sign that says Rush has been awarded its 6th Magnet Recognition Award, and now you'll know what that means. So having said that, yes, Rush nurses are special. They're the best. But within the MS Center, I believe that the Rush MS Center nurses are the ultra best. They're more than special. And I am so happy to introduce them tonight. and for you to get to know them a little bit more. So having said that, we'll start out with our clinic nurses. So we have 2 clinic nurses. We are hiring for a 3rd clinic nurse, and then we have infusion nurses. So our clinic nurses attend to your phone calls, your paperwork. They may accompany one of the providers in a visit, for example, Botox. And then our infusion nurses are responsible for the management of your infusions. So our first clinic nurse is Lorena Racy, but as Kathy said, she's not here tonight. I want you to know a few things about Lorena. So she has been in the MS Center for 10 years. She's very experienced. She received her MS certification in 2018. She graduated from Western Governors University with her bachelor's degree in nursing. And her background is in neuro ICU and then float pool, where you go from unit to unit. So she's a very experienced med-surg nurse. And that's it on Lorena for now. The next up is Ifra Schill. Ifra, if you'll unmute yourself and give us a little introduction.
Yeah, absolutely. So my name is Ifra. I have been a clinic nurse here at the MS Center for about 1.5 years. Before that, I did neuro ICU and then neuro step down med surg as well, similar to Lorena, but a little bit newer to the MS Center here. My background is I got my bachelor's in biology and then switched over to nursing. So I got my master's in nursing. I'm from Minnesota originally and moved to Chicago about 2.5 years ago.
Okay, thank you so much, Ifra. Okay, next we'll move on to our infusion nurses. Laura, do you mind saying a little something about yourself, please?
Sure. Hi, I'm Laura Coffey, and I'm one of the infusion nurses. I've been in the MS Center for 7 years, and I went to school at Rush, and I've been a nurse for 23 years, and I've continued my career at Rush the whole time, other than 2 years of some travel nursing that I did. And previous to my role here, I worked in the outpatient cancer center here at Rush for 7 years, giving infusions to the cancer patients. And prior to that, I worked in the hospital on a medical surgical floor, just like Ifra and Lorena, where you see a little bit of everything. And I love it here. It's really like a family, and I love coming to work here. It's a very intimate, wonderful place to work, and I'm happy to be talking to our patients tonight.
Thank you so much, Laura, and we love you working here as well. Next up is Camaria Price. Cam, would you like to say a little something about yourself?
Yeah. Hello, I'm Kay Maria. I've been at the MS clinic for a little under a year, and I've been a nurse for about 7 years. Kind of been all over. I did some inpatient, some outpatient. I was in the float pool, but I really love this clinic. The team is great, and we love the patients, so happy to be here. Something about me, I really like plants, so my apartment is filled with plants. I've killed a lot, but a lot are still going. So, yeah, that's me.
That's awesome, Cam. Thanks so much for that. Next up is our newbie, Danielle Salim. Danielle, say something about yourself, please.
Hi, everyone. My name is Danielle. I am the newest nurse in the infusion center. I am so lucky to be to have been picked to be a part of the team. It truly is a very special team here. I've been a nurse for 6 years. I've worked in general medicine, so far inpatient. So I'm now outpatient. I'm really enjoying it. A fun fact about me, I am I'm a Midwesterner through and through. I've lived in a few different Midwestern states. I was born in Michigan. I share my birthday with Henry Ford, and I was born in the Henry Ford Hospital, is my fun fact. And then I also won the Daisy Award last year at Rush, and that was a very big accomplishment for me. So yeah, that's me.
Thank you, Danielle. It's so interesting to hear more about you. And Danielle talked about an interesting award that all nurses here at Rush can win. We do have forms in our clinic. If you, as a patient, want to nominate your nurse, a nurse for the Daisy Award, please look for the Daisy Award form in the clinic, and then you can give it to the front desk upon completion, myself. I believe on the form, there's even an email address that you can submit to. Okay, Sarah Straight. Sarah, can you please say something about yourself?
Yeah, hi. My name's Sarah. I've worked in the MS infusion clinic for about 8 months or so now. I've been a nurse for about 10 years. I went to St. Xavier in Oak Lawn and got my BSN there. And I actually have a psychology degree from DePaul as well. Previously, I worked in the rheumatology infusion clinic here at Rush for like about 3 years. And then I also worked in movement disorders and neurology when I first started at Rush. So back to neurology, and I'm happy I'm here. A fun fact about myself, I'm a big Chicago sports fan, and I love the Cubs and the Bulls and the Bears and all those fun Chicago teams.
Oh no, Sarah, now the Sox fans know you're a Cubs fan.
Uh-oh.
My allegiance.
It's too late to take it back. Okay, and last but not least is Madison. I'm not sure if Madison is on the webinar. If
So
not,
I apologize. We sadly weren't able to get her on here. There were just some difficulties. I did just talk to her though, which is why I ran off screen. Just wanted to share she's been here for about a year. She is another huge team player. Whoever gets to meet her, I'm sure you'll love her. She has been a nurse for, I think it's been a few years now. She worked at Northwestern prior to here. And her fun fact, she wanted me to share that she read 40 books in the last year. Oh, and she is sorry about the difficulty. She really did want to be on the video as well.
If I may, I'm going to say something about this wonderful team. And, I had the honor to work now in 3 MS centers. And I think, you can look at services and MS centers in different ways, services that they offer, resources for patients. But I think what makes a place unique, what makes a place special, it's the people that works there. And nurses are fundamental in that culture that the place have. And I think one of the strengths that Rush has is you. It's this amazing team of individuals with talent, with experience, but most importantly, with a shared passion for what you do. And, that's contagious. You enter the MS Center and you feel that positive energy. And that's something that I think is a collective effort, is something that everyone makes everyone better. And, we all have good days and bad days, but I think that that positive attitude that you sense when you enter the MS Center is thanks to all of you. So I have to say that I'm honored to be part of this team, and I truly appreciate the fact that you took the time to highlight yourself here, so we get to know you better. And now maybe if you can tell us how can we work together better? What are the things that patients perhaps can do to optimize this wonderful talent and resource that we have at Rush?
Yes, absolutely. But before we go into our PowerPoint presentation, I do want to also acknowledge Adrienne Castillo, who just received her certification from the American College of Lifestyle Medicine, an unbelievable accomplishment, which reflects her dedication to advancing evidence-based, patient-centered care and just promoting lifestyle medicine for the ultimate best for our patients. So she truly has a passion for this area, and it needs to be highlighted. I think it's such an incredible accomplishment. And Dr. Miravalle, if you have anything else you would like to join to that as well.
We are also proud of Adrian. This is an accomplishment. It's very unique. Not that many people in the region hold that certification. And, with your passion and everything you've done for the Brain Health Center, I think this is just a cherry on top.
Absolutely. So let me go ahead and bring up our presentation. Congratulations, Adrienne.
Well, first, I want to say thank you very much. That was very special that I can celebrate that win for myself with everyone present tonight. You're my people. So it was a journey that since 2018, and one of the final destinations was to be able to become a certified practitioner in lifestyle medicine on top of the certification for family nurse practitioner. So one goal accomplished.
Oh, fantastic. Well, one thing I failed to say at the beginning for the audience, as with all of our conversations on brain health, please do not feel shy about raising any questions that you might have for this, this incredible staff here. So up at the top of your screen, you do see a Q&A box and a chat box. You can use either one of those. I will be pushing the slide, so unfortunately I can't see the questions as they come in, but Dr. Miravalle will be checking those for us as well. But once we're done with the presentation, I'll make sure I look over any questions that came through, and we'll allow for time to answer any of those within the time frame of this hour. So on that note, I am going to turn this over to Adrienne to kick us off with our presentation.
Thank you. All right, so tonight we're going to focus on communication in the healthcare setting and how to prepare for your MS visit. Next slide. So in case you plan on writing that Daisy Award, here's how to spell your nurses' names. And also a special day to recognize the nurses at the Rush MS Center with a thank you is May 12th, Nurses Day. Next slide, please. All right, well, we want to start off by saying that we want you to know that your healthcare team here at Rush is very committed to working with you to manage MS and to coordinate your care. And it definitely takes a big team to coordinate that MS care. It takes your neurologist, which is your MS specialist, such as Dr. Miravalle, myself, the advanced practice registered nurse, otherwise known as an NP, our registered nurses that you've met tonight. Medical assistants, we have 3 of them, Shirley, TT, and our newest medical assistant is Karina. Financial counselor, Melissa Pokras, who does everything from insurance, authorization to scheduling infusions, and a whole lot of in between all of that. And I believe Melissa's here with us tonight, so don't be afraid to ask a question for her. Our clinic coordinator, which is Anna. I think all of you know Anna well. She's been here for a long time. And our transition of care specialist, and I was like, wow, what a title. That's Alex, who does all of our specialty pharmacy work. So building a trusting relationship requires open communication, and making the most out of your healthcare provider visit really does involve good communication. Next slide, please. All right, so before the appointment, what? You just don't show up? No, now you have to prepare for your appointment. And, think about it this way. You want to bring intentional presence so that you get the most out of your visit and you remember the things you wanted to ask. So here's a few tips here for medical history. Gather information in regards to previous diagnoses, surgeries, medications. When you come to the MS Center for your visit, you're first greeted, once you check in, by the medical assistant, who you can share if there's any updates to your medical history, your family history, and whether you're taking new medications or continuing on the same medications, if you've had any surgeries in the interim. So this is for whether it's a new appointment or a follow-up appointment. We always want your medical file to have the most updated information possible. So in regards to an MRI, if you had an MRI at an outside facility, please be sure to bring your report and the MRI disc to the visit. We will upload that disc at our front desk in order to be able to view the images. Describe your current symptoms, including when they started, what makes them better, worse, or the severity. And medications and supplements include all the prescriptions that you're taking, over-the-counter medications and supplements, and let us know what you're allergic to and what the reaction is. So I always advise to keep a running list of medications and just add or delete as we go along. And then write down questions or concerns that you want to address during the visit, because sometimes you might get nervous or you're wrapped up in a bit of new information and you just don't remember what that important question was. So write it down and bring it. Next slide, Kathy. And then if there's any special type of considerations that we should be aware of, please let us know, such as language barriers. When English is not your primary language, you'll be asked if you need an interpreter when you're scheduling an appointment. If that doesn't happen for some reason, just let the front desk know that your preferred language is whatever that language is, and then we can always use our InterpreTalk phone, where we get an interpreter on the phone. If there's any cultural or religious considerations that could affect your care, please let us know at the time of your visit. And also, when scheduling your appointment at Rush, you'll be asked if you have any special needs. So special needs are whether or not you use a wheelchair, a walker, if you use oxygen, and you wonder, well, why do I have to do that? So I can tell you that every morning in our staff huddle, we identify special needs so that our staff is more sensitive to what specifically you do need. Special needs also include hard of hearing. So next slide. And then during the appointment, communication definitely is key. And, we start to build that therapeutic relationship with you by being honest. Be open and truthful about your symptoms, habits, and concerns. And me, as the lifestyle medicine practitioner, I'm aware of how difficult it may be to talk about certain habits. But when we start at a place of honesty, we just begin to develop that therapeutic, trusting relationship. And it really makes all the difference. And it's okay to ask questions if you don't understand something. Be curious. Don't be afraid to ask, or don't think that, oh, that doesn't sound like I know too much if I ask this question. We are here to help you and to make sure you get all of your questions answered, no matter how many times you've asked those questions. And it's just a little tip. Bring a notebook or use your phone to jot down important information throughout the visit. Take notes, especially if you come by yourself and you have to recall all that was said during the visit. It's super important to remember every bit of that visit.
Adrian, I'm going to pause for a minute. I have two comments on the chat box that I think I want to highlight. One says, thank you, nurses, for the love and care you give us. I always feel comfortable when I'm in clinic during my short stay. And the second one says, not a question, just a comment, for the extraordinary work nurses do. And then this is from Suzanne. She quotes, save one life, you are a hero. Save 100 life, you are a nurse. So I thought that's a nice way to kind of, again, highlight the important work that you all do. And, these are great tips, but at the end of the day, as Adrian mentioned, building that therapeutic relationship is getting to know each other. And I think that what you're highlighting here, the honesty, the curiosity, that's so important. So the more we get to know you, the more we can serve and help you.
Thank you. All right, so now after the appointment, there's always homework to do after the appointment. So go back, review your notes, make sure you understand everything. You'll also get an AVS, also known as the after visit summary, after your visit. So review that as well. Follow up on any instructions or any of your healthcare provider's recommendations. And, if you come alone, that once you get home, your family, your loved ones, your friends are going to ask how your doctor's appointment went. So This is a way with note-taking that you'll be able to remember what went on during the visit. Kathy, you can forward the slide. And more after the appointment. You got lots of things to schedule, most likely. Before you leave, it's best practice to schedule your next visit with the your MS provider. And he or she will inform you at that visit, at your current visit, when they would like to see you back. And Anna or whoever is at the front desk is happy to schedule your next appointment. And remember, here's a plug for myself, because I always have to get in plugs for myself. Even if you don't get a referral to come and see me, schedule an appointment with me, and you can do that at the front desk as well. If you have labs or MRIs or referrals, go ahead and get that scheduled. I often hear, oh, I didn't know that I had labs to do. They might be on your after visit summary. Maybe your doctor told you during your visit, but that's something you just didn't remember. But that's important to know whether or not you've got labs to get. And you can schedule them via my chart as long as you go to our lab. You can advance the slide. Okay, so Ifra and Lorena came up with some questions and answers that they deal with frequently as the clinic nurses. Number 1, how do I receive results of labs, MRIs, other testing? So first, check my chart. If you don't see anything in my chart, call. When you call for lab results, please let us know if they were drawn at an outside facility. We don't always receive outside facility results, so prior to calling you back, if we know you had labs done at an outside facility, that helps us be able to locate those results for you. When you're at the lab getting your labs drawn, often lab tests can get missed, especially if there's multiple labs to get done. So just simply ask your technician if they've completed all the labs that were ordered on the orders. And that's part of advocating for yourself to make sure that things get done in the most efficient way. Number 2, my doctor placed a referral during my visit. How do I schedule the appointment? Well, the information will be on your after visit summary, so please check the after visit summary. When all else fails, you can call or my chart and we'd be happy to assist you as well. But first, check your after visit summary. And you can advance the slide, Kathy. Number 3, how do I ask my doctor a question outside of my appointments? Well, please utilize my chart for non-urgent questions. You have to be signed up in order to utilize my chart. Call for symptoms or urgent requests. We'll get back to you within 24 hours. Check your AVS after visit summary because again, maybe a question can be answered with the information that's contained in your AVS. And also in regards to new prescriptions or refills, please check with your pharmacy first before calling us to see if they've received the prescription that you're inquiring about. And number 4, when will I receive my medications that come from a specialty pharmacy? Especially for disease-modifying therapies, it could take up to 3 to 4 weeks. When meds come from specialty pharmacy, pharmacy, they more than likely require a prior auth from your insurance company, and that's why it takes a while. Okay. All right, so this is where I hand off the presentation to the nurses. And I believe Sarah is up first. Is that right, Sarah? Did I get that right?
Yes, you got
Okay,
that right.
so she's going to talk to you about preparing for your infusion appointment.
Yeah, so here are some key points for preparing for your infusion appointment. You want to make sure you always provide updated insurance information prior to your appointment. It's good to know your allergies and your medications. We'll ask you, have your allergies changed? Have any medications recently changed and adjusted or like discontinued? We'll ask you, are there any new symptoms with your health, any changes in your health status? Always let us know if you have or if you've been sick with a fever or any other symptoms such as a cough. And then we want to make sure, if you were prescribed antibiotics, have you had any infections since your last infusion? These are all really important things to let us know before we start the treatment, because we want to get, be okay that you'll be able to get infused in case, you do have an infection or you recently were taking an antibiotic as well.
Okay, so further for preparing for your infusion appointment, we always say bring your veins. So really try and hydrate the day before. So drink plenty of water. That really helps the veins to kind of plump up, and we can find them and make the process a little bit smoother that way. So the infusion itself should not be painful. The needle stick you may feel a little bit of pain during the stick, but the rest of the infusion should be pain-free. So if you're having any issues, always let us know. And then we always encourage people to take your morning meds before the infusion. You don't have to hold meds at all. And you can also, well, it's helpful to eat something before the infusion appointment and make sure that you're hydrated. It just makes for a smoother process that way.
Besides that, we recommend wearing comfy clothing. You may be here between 1 hour to 5 or 6 hours if we have to observe you after an infusion. So you might be with us for a while, so please be comfortable. Besides that, we recommend wearing some type of clothing that we can easily access your arms to be able to do that IV when we need to. Besides that, we recommend bringing a laptop, a book, something to keep you busy if you're going to be here for a few hours. And we also recommend bringing a blanket. While we do have some on in the clinic, a lot of people prefer to have their own so that they can rest. We have some comfy chairs here that you can rest in. Besides that, we just hope that everybody is considerate of those in the room. Everybody does have their separate space, but we do ask our patients to bring in earbuds or headphones if you were to listen to music or something like that, so that it isn't distracting to others. This may be Madison's part. And if so, I will go ahead and read it. So we do have snacks, water and pop in the clinic that we are happy to give you. Please feel free to bring your own snacks and ask us, but we will offer you whatever you would like when you get here. We do not allow children in the infusion center for safety purposes. And there is one guest allowed for your visit. And you may need someone to drive you home. So in some cases, it's best if you do bring somebody, depending on how long you're going to be here and what your needs are. Please bring a government ID and your insurance card with you. And please be sure to identify any special needs when scheduling your appointment. Besides that, please be on time. We are a pretty busy clinic with a lot of patients. So if people are running behind, that can sometimes set things back. So we are very appreciative when you're able to be on time.
And I'm not sure who was next to read this. Was it Laura?
Read it. I can do it.
Okay, thank you, Laura.
Sure. A couple of things to remember while your infusion is going. We would definitely want you to tell us if you feel anything different, anything new that you didn't feel before the infusion started, itching, if you feel feverish, if you don't feel well at all, we would want you to tell your nurse right away. We also want you to, if you ever had any kind of pain or swelling at the IV site, that's another thing that we would want you to tell us right away so we could come look at it and make sure everything's okay with the IV. And all of these things don't wait. As soon as you see this happening, we would want you to tell your nurse or any of the nurses in the room. We have a restroom in both of our infusion pods. We have two sides to the infusion room. Each one has its own restroom, and we are always happy to help you in assistance getting to the restroom if you need. We can put you back in a wheelchair. We have walkers in the clinic that we could provide for you. And we happy to accompany you and sometimes in the restroom as well. So please don't ever hesitate to ask us. That is a common thing that we're happy to do during our days at the clinic here. We encourage you to ask any questions you might have. In the beginning, we will kind of go over how the day will play out, some of the medications we'll be giving you, and time frame for your infusion. But we want you to feel free to ask any questions either before the infusion starts or during the infusion as well, because there's so much that, especially when it's your first infusion, there's a lot to talk about. And so we encourage you to always ask us any questions you might have. And this is mine. I'm going to talk a little bit about what you might experience after your infusion ends and when you go home. There are some patients that do experience, it's not uncommon to hear people report a few side effects, usually the next day perhaps, or maybe the next 2 days. It's not uncommon to hear people say they may feel a little more fatigued, maybe a little achy. Some have reported a headache. So that's not, it's really, we hear that from a good number of patients. We want you to, it might even be a good idea, especially on the first couple infusions when you're getting used to how you're going to feel afterwards, to have that the next immediate day available to rest. We want you to rest if you are experiencing any of that. So you may want to have that day available in the future. Perhaps the infusions, you won't be feeling that, and you can kind of gauge yourself how you feel afterwards, whether you can. There are a good number of patients that don't experience those side effects either. They will come back to me in 6 months when their next, say, infusion would be, and I always ask them, how did you feel after you went home last time? Many patients do say, I was fine. Once I got a good night's sleep that night, I was able to resume my regular daily activities the next day. Some go to work, go to the gym. So it can just depend, but in the beginning, it might be a good idea, especially the first one, just to have that day or two available. And of course, we want you to call us if there's ever anything else going on besides just fatigue or a little achiness. We would definitely want you to call us if there's something different, like say you had a rash or your throat was feeling like itchy still, or anything was itchy, that's something we would want to know right away. If you ever had any hives, or so we would want you to use the clinic phone number. Those are things that we wouldn't want you to use my chart. We would want you to call us so that someone from our office, one of our team members, can call you back to talk about that. And on that note, if it's ever anything, and this goes for any patient, or really any one of us, if you ever experience more severe symptoms, I in my 7 years here, fortunately have never heard someone experience this, but it's not out of the question. If you ever had chest pain, shortness of breath, tightness in your throat at home, we would want you to, if either have someone take you to the emergency room, or if it's very severe, you call 911. So that's just a general piece of advice for any patient, not even just in our clinic, but and really for all of us, just to remember that you don't wait for a call back from us. We want you to get more immediate help. And when you're in the clinic, after your infusion is done, we do recommend, just like the physician appointments, we would want you to go ahead and schedule your next appointment. And that's really good to do, first of all, so that you can kind of, it's on the books and you can kind of forget about, you don't have to remember to do that. But also the appointments do get filled up, especially the physician appointments, but also the infusion ones. This allows you more availability for you to pick, which day of the week. And sometimes patients like to line up their infusion appointment with the doctor's appointment, and so they don't have to make a separate trip. But others do prefer coming in separately and just having their infusion appointment and then the doctor separately.
Excellent. Well, I have a few questions here. But the first one, I can probably address because it has to do with icometrics, which is this new software that we have on MRI, and which, by the way, is live. So I know that we've been talking about this now for nearly a year. This is an MRI, artificial intelligence used to kind of provide more information from your MRI. So it's called icometrics, and that's live as of January 1st. So any MRI orders that were placed after January 1st will include icometrics. Any orders that were placed before January 1st will not. So even though you may schedule your MRI in March and the order was placed in November, that will not include icometrics because the order was placed before January. So I encourage, if you want this software to be part of your care, which I recommend, if the order was placed before January 1st, maybe give us a call and we'll issue another order for the MRI. So moving forward, any MRIs that we placed in the future will include icometrics. But the question has to do with that, and also with an app that comes with this software called iCompanion. And that's free. Anyone can download that in your app store. You can use that, and that is a way for you to keep a diary of symptoms on a day-to-day basis, and also it's a reminder of medications. It has games if you want to play, for example, some memory games, or ways to actually keep engaged with certain MS specific tasks. So it's called iCompanion, and we are working with the manufacturers to purchase the license so we can actually input all of your information. Of course, if you give us permission, we can input all of that information into your medical records. So that's going to be wonderful in case you want us to have that information as part of your care. Anything you input in the app will now be able to translate to our electronic medical record. So that piece is not ready yet. You can use the app, but we still don't have access to that information. But we are working on it. As soon as we go through all the legals and all the HIPAA rules and everything that we need to actually discuss this with, we'll make an announcement. But you can still use the app, and you can bring the cell phone with you, and you can share the information with us, but we will not have access to that yet. Another question that I have here, which I love the question because it allows me to brag about MS Center at Rush. So the question is that from someone that is receiving their care exclusively from doctors at Rush in various practices, but not in the MS clinic. So he's asking if we recommend to transfer the care to the MS clinic at Rush. Of course, I'm going to say yes, but not just because I love what I do and the people I work with. It's always a good idea to consolidate your care as much as possible into the same team. We take pride in what we do, and I believe we offer a comprehensive multidisciplinary approach to care, which is very unique in the region. We are the largest MS center in the region. We cover over 3,000 patients. In terms of research, we have the largest infrastructure for research, and now we have this very unique brain health program, which is unique in the region, now with a certified nurse practitioner in lifestyle medicine. So I think all of that speaks to, the passion that we have behind this, which I think is an added benefit to having your care consolidated into one location. And that's the last question.
Well, and there was one other question that came through actually, and that's so perhaps it wasn't overly clear. So this is our multiple sclerosis center, and these are MS infusion nurses. So the question around what drugs will you infuse, antibiotics? So these are definitely MS disease modifying therapies that we're talking about.
And I see one more question that just came in, which is,
Yes.
does the MS clinic treat MOGAD? Of course we do. So MOGAD stands for myelin oligodendrocyte-glycoprotein associated disease. It is a rare disease, but we continue to learn more about as new cases have been discovered. And that falls under the umbrella of neuroimmunology. So we do see patients with MOGAD. We are actually participating in the Sumaira Foundation Patient Day that is going to be in Chicago on July 27th. So the Sumaira Foundation is the largest foundation for neuromyelitis optica and MOGAD. That's a global organization, and every year they choose one site, and this year they're going to choose Chicago, so we're very proud of that. So it's going to be a large event for patients and their families on July 27th, and we're going to help to host that event. So more to come, but yes, we'll be happy to see you in our clinic as well.
And the last question that actually just came through is the phone number to call for the clinic. And I can go ahead and I think I can actually write that into the chat box, but it's the general number, the 312-942-8011. Let's see if I can respond to that.
I think I just posted a response with the number.
Yes, you did. Thank you, Ifra. Fantastic. Any other questions for the team? This is a wonderful opportunity, folks. You have them all here at the same time. Augusto, any other updates from your end that you might want to share?
I'm going to ask everyone to go around the table and tell me what makes you proud of being at Rush. So there is one thing that makes you proud of being in this team, or perhaps makes you happy to wake up and go to work. What will be that one thing that probably defines what makes you happy of being part of this team? Adrian,
Anybody can go.
I'm going to say our staff that I come into every day is just makes walking into work just great. My fellow nurses that are like, we are all truly work as a team. We're helping each other, but also the physicians are also wonderful and approachable. And Adrienne is just she's also our manager in addition to everything else she does. And she's just so wonderful. And so it really is. I've been here 7 years, and I do talk about really how wonderful it is to come to this job every day. And it's the people that work here that make it's a family.
Lovely.
I can go next. Well, and Laura, thank you so much for those kind words. It's easy to be a wonderful manager when I have the team of nurses that I do. So thank you guys for being so dedicated and hardworking. But I think as the manager, when I first got that role in 2010, I really envisioned an MS center that was, as soon as you stepped inside, it would be very healing, that you would feel a sense of peace, recognizing that so often patients living with a chronic illness, whether symptoms are visible, invisible, the world out there is cruel, but the world inside the MS Center is one that is nurturing and comfortable and safe. And I have to say that, right now, before your very eyes, is from the providers to the nurses to our administrative staff and medical assistants, everyone promotes a sense of well-being, respect, trust. And so a therapeutic relationship with our patients truly starts the moment you step inside the MS Center. And I have wonderful Press Ganey scores that I can share with you to prove that. I mean, the goal at Rush is to get, 94% satisfaction. And on a week-to-week basis, we are well above 94. We're mostly in the 97s and 98s. So thank you very much for those who submit feedback after visits. We truly appreciate it. And so that's what makes me very happy and proud to work here.
Fantastic. And we're getting lovely comments that are coming through in the Q&A as well. And I'll be sure to share that with everybody on this team afterwards.
Well, there's one question that I want to maybe address is if you have other health issues like a cold and gynecological issues or allergies, should we still go through the other specialist or should we go through the MS center? And I'm happy to address that, but we recommend you go through your specialist for specific issues with your women's health or with gastroenterology, of course. Those are things that we want you to remain involved with your specialists. But also, when you come and see us, maybe give us an update. So if something changed in your health and you have a new diagnosis or a new treatment for other unrelated issues, we still want to know that because it might be pertinent to the decisions that we make on behalf of your care.
And a question that just came through, can we ask our nurses to wear masks if we're worried about flu, COVID, etc., while in clinic? I would say absolutely. Yeah, they're all shaking their heads. Absolutely. There was an earlier question about Botox, and maybe somebody can speak about that.
Yeah, so we use Botox quite a lot. It's for mostly the number one indication is for spasticity related to multiple sclerosis. We inject the Botox in the muscles that are involved with that spasticity or stiffness. There is also an indication for migraine headaches and also for cervical dystonia. So up to 30% of MS patients suffer from migraines. And even though we are not a headache clinic, if you do have a recommendation from your headache specialist on using Botox, we'll be happy to also apply that just to facilitate your care. But I will say the number one indication that we use in the clinic is spasticity or stiffness in the muscles.
Perfect. Thank you, Dr. Mirabale. Well, we have a minute left. So if any of the other nurses would like to just highlight anything before we adjourn, um, any last parting questions or comments from the team?
Thank you so much for putting this all together and having us on. It was a pleasure.
Absolutely. Thank you for joining us. So for the audience, next month is MS Awareness Month. So we are going to be hopefully inviting MSAA to join us for our next month's session, which will be, as usual, the second Monday of the month, and that will be March 10th. So we look forward to having you all back for that session and to highlight a few of the wonderful things that is out there to really speak about our MS Awareness Month. So I appreciate everybody joining us for the evening, and a huge thank you to this incredible team. I really do have to say kudos to all of you for all your fantastic work. It shows, and even by seeing some of these wonderful comments that have come through. So congratulations to all of you. Now you can go home. I know you're still there at the hospital, so adjourn, make it home safely, and thanks so much, all of you.